So Meredith, how do you know which vein to use?
We put the tourniquet on, we clean with a little alcohol. Sometimes the friction, the heat helps the vein surface up a little closer.
So that's kind of why you were like tapping it?
Mm-hmm, absolutely.
All right. If you were unable to find a vein, do you have alternatives that you try?
Yeah, so if there's nothing I see when I'm first looking for a vein, then we can just put a heating pad on your arms. We just wrap it like all the way around both arms, and the heat can also help bring that veins to the surface.
So why is that clear coat you put like an adhesive that looked like saran wrap over? Like, why is that there?
Yeah, so that's on there to keep the IV secure. So the needle comes out. The needle helps to guide the IV in. And so it's just a little catheter in there. So it helps to hold it down, but it's clear so that way we can see and monitor the site to make sure there's not any irritation.
Okay. So am I going to feel a certain way as I'm waiting for the IV to finish or like finish dripping?
Yeah, so you should feel like you'll feel a pinch when the IV goes in because that needle guides it right in. And then once we get it connected to the fluids are room temperature. So they can actually feel a little bit chilly because room temperature is about like 20 degrees less than we are. And so feeling a little chilly is a normal side effect during your infusion.
Okay. I'm assuming not all IVs run the same speed, but like, is there ever a time when like someone's like, oh, I want to try to get this done as fast as possible? Like, is there ways to like increase the speed or like speed up the IV?
Yeah, so it's all dependent on the size of the vessels. Most of our infusions go between 30 and 45 minutes, but sometimes depending if you've got a really tiny vein, it might take a little bit longer. So it really is going to be dependent on the size of the vein.
And then last question, I seen this at a hospital where like their pole thing that you have the IV dripping from, like that wasn't as high. It was like much lower. What does that do? Like, does it matter, the height?
Yeah, so actually if you raise the height of the pole, our infusions here work with gravity tubing, and so the infusion will go in faster. So one way we could slow the infusion down is to lower the level of the pole.
Why would you want to slow it down for somebody?
Sometimes people, just that chilly feeling of the fluids is uncomfortable, and so they might want it to go in a little longer, closer to that hour mark. Some infusions that we do sometimes are high dose vitamin C. It can sting a little bit, and so we try to keep that one actually as closer to like 1 to 2 hours because it can sting. So that would be another reason we'd slow it down.
Okay. Like, how would someone, if they never got an IV, like how would they know if it has some positive effect on their body? Like they had a good bodily response? Like,
there's tons of different things. Sometimes just from the fluids alone, like when we're dehydrated, we can feel more fatigued, and so you might even just get more energy just from the fluids themselves. But things like the B vitamins and the vitamin C, especially at that lower dose of vitamin C, can give you like a good boost of energy. So you probably won't feel much like walking out of here, but over the next 24 hours, you could really see a difference in your energy.